Welcome to Rerzeh Health, your ultimate health and wellness guide. Understanding hepatitis A, B, and C causes, symptoms, prevention, and treatment. Hepatitis is a serious condition that affects the liver, causing inflammation and potential long-term damage. There are several types of hepatitis, but the most common viral strains are hepatitis A, hepatitis B, and hepatitis C. These infections can range from mild to severe and, in some cases, become life-threatening. In this article, we will explore the symptoms, transmission methods, affected organs, health risks, prevention strategies, and available vaccines for hepatitis A, B, and C. Hepatitis is an inflammation of the liver, an essential organ responsible for detoxifying the blood, producing bile for digestion, and storing essential nutrients. When the liver becomes inflamed due to a hepatitis infection, its ability to function properly is impaired, which can lead to severe health complications. Each type of hepatitis virus affects the liver differently, and understanding the key differences can help in prevention and management. Symptoms of hepatitis A. Hepatitis A often causes mild to moderate illness. Symptoms usually appear 2 to 6 weeks after exposure and can include fatigue, nausea and vomiting, abdominal pain, loss of appetite, jaundice, dark urine, and fever. In some cases, hepatitis A infections can be asymptomatic, especially in children. How is hepatitis A contracted? Hepatitis A is primarily spread through the ingestion of contaminated food or water. It is a fecal-oral disease, meaning it spreads when a person consumes food, drinks, or objects contaminated with the feces of an infected individual. Common sources include eating food prepared by someone with HIV who didn't wash their hands properly, drinking contaminated water, consuming raw or undercooked shellfish from contaminated water, and close contact with an infected person. Organ damage and health effects. Hepatitis A causes temporary liver inflammation but does not cause chronic liver disease. Most people recover within a few weeks to months, and the liver heals completely. However, in rare cases, severe infection can lead to acute liver failure, especially in older adults or individuals with pre-existing liver conditions. Prevention and vaccine availability. The hepatitis. A vaccine is highly effective and provides lifelong protection with 2 doses given 6 months apart. Good hygiene practices such as washing hands regularly, especially before eating and after using the restroom, can reduce the risk. Safe food and water consumption, like avoiding drinking unfiltered water and eating raw or undercooked seafood in areas with poor sanitation, is also crucial. Symptoms of hepatitis B. Hepatitis B can present as an acute or chronic infection. Symptoms appear 1 to 4 months after exposure and may include fatigue, joint and muscle pain, fever, dark urine, pale stools, jaundice, and nausea and vomiting. Some people, especially young children, may not show symptoms, leading to silent transmission and long-term complications. How is hepatitis B contracted? Hepatitis B spreads through contact with infected blood and bodily fluids. The most common transmission methods include unprotected sex with an infected person, sharing needles or syringes, from mother to baby during childbirth, sharing personal items such as razors or toothbrushes, and blood transfusions, though this is now rare due to screening practices. Organ damage and health effects. While some people recover from an acute HBV infection, others develop chronic hepatitis B, which can lead to liver fibrosis, cirrhosis, liver failure, and liver cancer. Chronic hepatitis B can remain asymptomatic for years, making it a dangerous condition if left undiagnosed. Prevention and vaccine availability. The hepatitis B vaccine is safe and highly effective, requiring 3 doses for full protection. It is included in routine childhood immunization schedules. Practice safe sex by using condoms to reduce the risk of transmission. Avoid sharing needles or personal items like razors and toothbrushes. Screening during pregnancy is important, as pregnant women should get tested for HBV to prevent transmission to newborns. Symptoms of hepatitis C. Hepatitis C is often called a silent disease because many people do not experience symptoms until liver damage has progressed. When symptoms do appear, they may include fatigue, loss of appetite, abdominal pain, jaundice, nausea, and dark urine. How is hepatitis C contracted? Hepatitis C spreads primarily through blood-to-blood contact. Common methods of transmission include sharing needles or syringes, receiving contaminated blood transfusions before routine screening began in the 1990s, unsafe tattooing or body-piercing practices, and needle stick injuries in healthcare settings, organ damage and health effects. Unlike hepatitis A and B, there is no vaccine for hepatitis C, making it one of the most concerning forms of hepatitis. Many people with HCV develop chronic hepatitis, which can lead to liver cirrhosis, liver failure, and liver cancer. Because it progresses silently, HCV is a leading cause of liver transplants. Prevention and treatment. Avoid sharing needles and personal items to prevent HCV. Ensure that medical and cosmetic procedures like tattoos and piercings are done in sterilized environments. Regular screening is recommended, especially for individuals at high risk. While there is no vaccine for hepatitis C, modern antiviral medications, known as direct-acting antivirals, can cure HCV in over 95% of cases if diagnosed early. Hepatitis D, also known as HDV, is a less common but highly serious form of hepatitis. HDV is unique because it can only infect individuals who are already infected with hepatitis B. This is because HDV requires the hepatitis B virus to replicate in the body. Transmission of hepatitis D occurs in similar ways to hepatitis B, primarily through contact with infected blood or bodily fluids. This can happen through sharing needles, unprotected sex, and from mother to child during childbirth. The symptoms of hepatitis D can be severe and include jaundice, fatigue, abdominal pain, nausea, and joint pain. Because HDV can accelerate the progression of liver disease in those already infected with HBV, it can lead to more rapid development of liver cirrhosis and liver cancer. Preventing hepatitis D largely involves preventing hepatitis B infection. This means getting vaccinated against hepatitis B, practicing safe sex, not sharing needles, and ensuring that any medical or cosmetic procedures are conducted in sterile environments. Currently, there is no specific vaccine for hepatitis D, but controlling hepatitis B infection can effectively prevent HDV. Early detection and monitoring are crucial for managing hepatitis D. If you are at risk or believe you may have been exposed, consult your healthcare provider for testing and appropriate care. By taking these precautions, you can significantly reduce the risk of hepatitis D and its severe health consequences. Hepatitis E, or HEV, is another form of viral hepatitis that primarily affects the liver. HEV is most commonly transmitted through contaminated water, making it a significant concern in areas with poor sanitation and limited access to clean drinking water. Although less common in developed countries, HEV outbreaks can occur, especially in regions with inadequate water treatment facilities. The symptoms of hepatitis E are similar to those of other hepatitis viruses and include jaundice, fatigue, abdominal pain, nausea, vomiting, and fever. Most cases of HEV are acute and self-limiting, meaning they resolve on their own without causing long-term liver damage. However, in certain populations, such as pregnant women, the elderly, and individuals with weakened immune systems, HEV can lead to severe complications and even be fatal. Preventing hepatitis E involves ensuring access to clean, safe drinking water and practicing good hygiene. This includes washing hands thoroughly with soap and water, especially after using the restroom and before handling food. In areas where HEV is common, it's essential to avoid drinking untreated water and to be cautious about consuming raw or undercooked shellfish and other foods that may be contaminated. Currently, there is no widely available vaccine for hepatitis E, although vaccines have been developed and are used in some countries. The best protection against HEV remains good sanitation practices and access to clean water. If you suspect you have been exposed to hepatitis E or are experiencing symptoms, consult your healthcare provider for testing and appropriate care. By understanding the risks and taking preventive measures, you can significantly reduce the likelihood of contracting hepatitis E and help protect your liver health. Hepatitis infections can be dangerous, but they are largely preventable with proper hygiene, safe practices, and vaccinations. Here's a quick summary. Hepatitis A is spread through contaminated food and water, usually mild and self-limiting, and can be prevented with the HAV vaccine, hygiene, and safe food handling. Hepatitis B is spread through blood and bodily fluids, can become chronic and lead to liver damage, and can be prevented with the HPV vaccine, safe sex, and avoiding sharing needles. Hepatitis C is spread through blood-to-blood contact, often silent but leads to serious liver disease, with no vaccine but effective treatments available. By getting vaccinated, practicing good hygiene, and avoiding high-risk behaviors, you can protect yourself and others from these potentially life-threatening infections. If you think you may have been exposed to any form of hepatitis, seek medical advice and get tested, as early detection can make all the difference in treatment and recovery. If you enjoyed this video, hit that like button, subscribe, and turn on notifications so you never miss a new workout tip. Thanks for watching, and I'll see you in the next video.